Okay, it's Dr. Buford. We're just getting started on the left shoulder. We're looking in from the back to the front. Everything's magnified 30 or 40 times. You're laying on your side. This is the back of the shoulder. As we look back here and see the posterior humeral head, that all looks good. We can rotate down and see the glenoid. The articular surfaces here look good. And then what we call the weight-bearing portion of the humeral head right here that articulates with the glenoid, that looks pretty smooth too. So the upside of that is it means you don't have any significant arthritic changes right now, which is great. Now here's where the problem is. You got two things going on. One is this biceps anchor's loose, and that can be a source of pain. And the other is this rotator cuff tendon's torn. So the first step is to take a pair of scissors. In a minute, we're going to take a spinal needle first and pass a free shuttle relay through it. And so if you look on the screen there, you'll see that little needle coming right through the middle of the biceps tendon, hopefully in just a second here. There it is right there. And now through that, we're going to pass a black kind of nylon-coated wire called a super shuttle grasper. We'll pass that through until we see it. And then we're going to grab it with this grasper here. So if you keep watching the tip of that needle, hold the camera, please. Okay, pull the needle out, please. I got it. Okay, so now we have the relay in. We're going to take a free suture, and we're going to load this relay. The relay has some holes in it where we can, I got it, where we can place suture through. So as we pull back, see how it brings that blue and white striped suture? So now we're going to do the same thing one more time with the spinal needle. I got you. A slightly different angle. And there we are coming through the biceps again. We'll go ahead and feed the relay again. We'll show you some more in a minute. Here you go. Okay, so now here's the trick this time. We've just grabbed the relay, but here's the trick. We're going to sneak around behind the biceps this time. And then we'll take the relay out. And we'll show you some more in just a minute. There's the relay. You see it. We just grab it like that. And now we'll pull it out through here. Then you'll see what happens once we load it. Now you did. Okay, so now we're going to pull back on the relay. And you can see that's going to take that suture through. But here's the trick, and why we do it. If you keep looking, it's going to bring that suture all the way around. And so that's what we call a purse string suture. And that gives us a very strong hold on the biceps. So next you need a pair of arthroscopic scissors so we can release the biceps and it won't bother you inside the joint anymore. We're going to release it right here, just a little bit away from where it inserts into the labrum. There it is. And now this won't cause any more problems, hopefully. We're going to use our shaver next to look up at the rotator cuff tear, which is right here. This just helps us identify the extent of the tear from the articular view here. And so there you can see how that tear extends all the way up. So we're going to change positions with your shoulder in just a minute here and get to work on fixing the rotator cuff tear. Okay, we've got a burr in. We're up above the rotator cuff now. This is the part of the shoulder called the subacromial space. And you really didn't have a big spur to worry about, so I'm just really dusting the anterior and lateral edge of the acromion to make sure that there's nothing that can pinch on our repair. So we can see that pretty well now. Put the shaver back on. And the rotator cuff tear is going to be right down here. You can see the biceps sutures. That area of the tendon right there is where the tear is. You'll see that in a second as soon as we just unroof it. And you can see how just right that quickly you can see the tear, okay? So we're gonna go ahead and open this up and then put an anchor down to repair it and get you on the road to recovery here. Okay, this is where we're going to place our suture anchor, about 5 or 6 millimeters back from the articular margin, which is right there. So we'll make a little nick in the skin, pull. And we'll take a guide down. Okay, so in just a minute you'll see that. I gotcha. There's our guide coming down. And we're going to place it back basically right in the middle of, I need the anchor, right in the middle of the area that's torn here. So there's the tear. And there we are with our anchor. So now we have 3 sutures to work with. We'll pull tight on them to make sure that's very solid. And now we're going to work with these one at a time, starting from right to left on the screen. In order to do that, we're going to take out one of the sutures. And we can work with this blue and white striped one first. Yeah. So we'll take out that suture right there. And now we're going to be passing our needle from right to left on the screen. Hold the camera there. Grasper, you got it. Record. Okay. So, there's our first pass. Look down. There's our needle tip right there. We'll feed that through. We'll show you some more in a little bit. Pause. You got to hold it long. I got it. Go ahead and load that. Okay, so now we're going to start tying these sutures one at a time. We've got them all passed. We haven't tied any of them yet. We're going to start with this blue and white striped one. Remember, there's the hole right there, so we'll go ahead and get to work. We'll show you some more in a minute. Okay, we're all done. Let me show you what we've got accomplished here. This is the most posterior suture right here, that blue and white striped one. And you can see how that's holding down that part of the rotator cuff there. Then as we rotate a little bit, you can see the middle suture from the triple loaded anchor. It's a solid blue one, and then the anterior suture is that black and white striped one. This other blue and white one, that's your biceps tenodesis suture that we've tied. And so if we were to keep going this way, this would take us down the front of the shoulder if we kept going down here. But what we can see here now is we've got 3 really strong sutures holding down the rotator cuff, and I'm happy with the way that looks. So we're going to finish up here. We're going to get you back to the recovery room in just a few minutes, okay? Good luck to you now. Bye-bye.